Welcome back. In this audio lecture, we're going to be covering another infectious disorder of the lower respiratory tract, and that is tuberculosis. So, tuberculosis was a very serious disease that was going away, and it is still around. It doesn't really go away, but it can cause death, right? Um, so it's an infection. It's an infection that's caused by the mycobacterium tuberculosis. Okay. That is a slow-growing bacteria that is resistant to bodily defenses. So even in healthy people, this tuberculosis bacteria can cause an infection. Okay. And then in sick people and in people with compromised immune systems, it causes larger effects. Okay. So it killed 1.5 million people in 2014, so it is still very prominent. So in pneumonia, that was a disorder that only resulted in as little as 58,000 deaths. So this is 1.5 million deaths worldwide, but that is a pretty big problem, right? And so it can spread really easy and cause this death. So tuberculosis transmits through aerosolized droplets, right? So you have these two gentlemen over here in this image. This gentleman has tuberculosis, and the reason I know that is because he has a dark spot in his lung. We'll talk about what that is in a second. But um, as it is this he's spreading these germs, and this person over here is inhaling those droplets. Well, some of those droplets are getting into his lungs, right? And they are causing the infection to spread into his pulmonary tissue as well. Okay. We see that tuberculosis is a pretty hardy bacteria, and that it can actually survive dehydration, which a lot of bacteria cannot. Once they get on the surface, they start drying out, and then that disrupts the cell. Now, it can be destroyed by UV light, heat, and alcohol, and so this is why it's a good idea always to sterilize surfaces or wipe it down as close as possible. Um, and so using some kind of alcohol treatment if you think you may have been exposed, or you are around somebody who has tuberculosis, which you should not be. We see that UV light destroys cell membranes. So UV light is really the most effective way of sterilizing surfaces. This requires maybe putting it on the sun for a bit, or in a hood that has UV light. We see that it's spread in immunocompromised people more often, and so in HIV infection, you see a depressed immune system function, and so this can result in death in these individuals. Now, we see that transmission is also present anytime you have an overcrowding. If you have a virus or bacteria that is highly susceptible towards transmission through aerosolized droplets, then being in an overcrowded area like an airport, like an airplane, a classroom, can result in this transmission of tuberculosis. So tuberculosis has two different stages of infection. Um, the primary infection that occurs when the bacillus first enters the body, okay, travels to the lymph nodes. Once it travels to the lymph nodes, the immune system detects it, and it generates a type 4 hypersensitivity. Remember that the type 4 hypersensitivity is a delayed hypersensitivity, meaning your immune system now has antibodies for it. However, it doesn't generate a response from this first infection, and it actually goes into dormancy. So the lymphocytes and macrophages form a structure called a granuloma. Okay, the granuloma contains live bacilli, and they form a tubercle as a result. Okay, the resulting structure occurs, and that a necrosis forms from that walled-off little area, and really that is a form of caseous necrosis. Remember the cottage cheese-like cell death. Okay. Um, Now, the intact immune system goes on about its way, and then this structure becomes a gone complex. A gone complex is what you see in this image right here. So this is a gone complex. So if you were to put somebody in an X-ray and then take an image of it, this gone complex would be present, and that would indicate a prior tuberculosis infection. Okay, so now this primary tuberculosis infection can now then keep on growing, and it can keep on getting larger. And so when that primary infection becomes so large that it cannot be contained anymore, it develops into a secondary infection, which we'll cover on the next slide.
Now, it is the secondary infection that is the concern, in which we cannot maintain the primary infection any longer, um, which is why we see a delayed hypersensitivity here. Okay, so the infection cannot be delayed, and the infection has gotten worse, and it starts to really reactivate, right? And so now the bacilli that were in our body that were dormant are no longer dormant, and so we start to see it start to propagate to other organs, and we develop symptoms of pneumonia infection, right? So a nice example of these type 4 hypersensitivity is the TB test, right? The test where they inject some deactivated tuberculosis antigens underneath your skin, and if the wound gets bigger, it means you've previously been exposed to tuberculosis. Okay, it's because you don't know it unless you test positive for this, what is called a Manot test. So let's look at the flow chart for the pathogenesis. So we're exposed to tuberculosis and any number of these conditions, so weak immune system, malnutrition, overcrowding, substance abuse, all of which we see in the urban areas in China and urban areas in the United States. We see that really the overcrowding is really a big one. This exposes the individual to airborne droplets of the bacteria that are in the respiratory water. The droplets can enter the alveoli, triggering an inflammatory response. Okay. So then we isolate the bacilli, and some of the bacilli are destroyed. Some of them are phagocytized, and so that is the destruction. Some of the bacilli enter the dormant stage. And so if they enter the dormant stage, if it's a immunocompromised person, um, we see that you get the formation of tubercles. Remember, the tubercles again are going to be the structure where we see the caseous necrosis. Okay, so they begin to calcify. The immune system breaks down the tubercle, and then we get reactivation of the bacilli bacteria. Now this occurs probably several years after the initial infection, which occurred over here. So then you just start to display some symptoms, which we'll cover in the next couple of slides. Positive chest x-ray and a sputum culture, right? So, and then we start various treatments, and we have multiple treatments that I'll talk about later on. All the while, you will test positive after you've been affected for the Manot test. Okay. So some manifestations of tuberculosis include productive cough, hemotisis, which is blood in the coughs. We have night sweats, fever, so things that you might not think about too much. Chills, fatigue, and so a lot of these manifestations would maybe suggest that you have a fever or flu, right? As soon as you start coughing up blood, the hemotisis, then that is a concern, okay? And so generally they'll put you in isolation at that point if you enter the hospital coughing blood, right? We might experience chest pain. So if we look at this little cartoon over here, we might experience chest pain. In addition, since now we have a pulmonary infection, we're going to be probably fatigued. We'll have unexplained weight loss because now we can't really we can't digest things as well, and so we're not producing as many of the enzymes necessary, and so we're not absorbing things very well. Anorexia can be due to this weight loss, and due to this decreased ability to produce ATP, and it's having an effect on other organs. Right, and then we start to see symptoms of other organs when the bacteria starts to spread in our body. All right, so to diagnose tuberculosis, we're going to be looking for all these manifestations, and so the diagnosis is going to include a physical examination and general history. Okay. We're going to conduct a skin test, so a Man-2 test, and this is a Man-2 test down here where we've injected a little bit of inactivated antigen from the tuberculosis, and we're looking for the spread of the redness, right? And this is going to indicate a positive test. Likely, because we're seeing this start to spread, we're seeing probably a delayed hypersensitivity here. Okay. For a chest X-ray, we're going to be looking for really the tubercles or gone complexes, and we'll use a CT scan that's going to allow us to take a 3D picture of the lung instead of just a static picture. We'll probably conduct a sputum culture, so a bacterial culture of our sputum looking for the tuberculous bacteria. How are we going to treat tuberculosis? We're going to give antimicrobial combination therapy, and so this accounts for antibiotic resistant strains of the tuberculosis bacteria, right? And so rather than just treating with one, we want to try to treat with multiple bacteria, multi-antibiotics, because antibiotic resistance among bacteria is such a prevalent problem in today's day and age. In a lot of places, we give free medications because this could create an epidemic in some places, and so very much like current infections, we should be treating highly infectious diseases like tuberculosis with free medication and try to prevent an outbreak of these diseases. Okay. And so some states, non-compliance is actually unlawful because now you are putting other people at risk, right? And so so if you don't, for example, this is a common thing among really contagious diseases, right? And so if you don't, like AIDS, for example, HIV infections, if you don't let somebody know that you have HIV, if you know, then you are accountable for an infection and you could be held for some sort of homicide. Okay. How are you going to prevent tuberculosis? Respiratory precautions. So this is putting on a respiratory mask of some sort, adequate ventilation at home, and making sure that you are not being exposed to other individuals. Okay. If you're in the hospital, this is going to be a negative pressure room. So a negative pressure room is a room that draws air into it rather than having positive pressure rooms which pushes air out of the room, right? So it has a negative pressure, allowing the buildup of preventing the buildup of air in there, right? And really the best prevention of it is vaccination, right? So now you're going to be giving vaccinations to prevent the bacteria from growing in your body. All right, so that's the end of this lecture over tuberculosis and infectious disorders of the lower respiratory tract. Until next time.